To sustain life, three things are important. You have to eat, you have to drink, and you have to breathe oxygen. And if you stop breathing oxygen, will be the fastest way that you will die. Therefore, oxygen is used in the treatment of acutely and critically ill patients abundantly. Actually, we use oxygen probably a little bit too much. If you ever observed someone in a soccer match spraining his ankle and the medical team will run on the pitch, they will start treating the patient with oxygen immediately while there's nothing wrong with his or her lungs. In the intensive care unit we use oxygen all the time because patients are mechanically ventilated on the ventilator. And usually we give fractions of inspired oxygen which are significantly higher than in the ambient air. In the ambient air around us there's 21% oxygen, but we usually treat patients with 50 or 60% of oxygen or even more. So we performed a systematic review of all the data of all the patients treated with oxygen, and we found out that actually in clinical trials, if patients enter up in a hyperoxic setting, so oxygen is higher than is usually be anticipated, then the clinical outcome of those patients is worse. And for this we already set up an animal model of hyperoxia in which mice are ventilated using smaller ventilators as these, of course. And in these studies we have seen that if you increase the inspired fraction of oxygen in these mice, the higher the oxygen levels are, the worse these mice do with respect to mortality, but also respect to the inflammatory response in the lung. And using the award that we have been given today, we would like to investigate this a little bit further. For this we would like to treat these mice with these different levels of oxygenation and investigate the pathophysiological mechanisms involved. Our hypothesis is that mitochondria play an important role in this sterile injury that we have observed. If you give a lot of oxygen, you also end up with a lot of free oxygen radicals, and these radicals might be detrimental to the mitochondria, and actually they will start to break up. And for this we have pinpointed some receptors which we think might be important, such as the RAGE receptor, the receptor for the advanced glycosylation end products. And using the grant that we've been given today, we would like to focus on this receptor and on these damps of mitochondria to see whether we will be able to stop the detrimental effects of hyperoxia that we have observed in our animal model.